I'm here today with Dr. Carolyn Saluti of Saluti Sports Medicine. My name is Kelly Duggan. I'm the founder of PTU, and we're going to talk all about youth athletic injuries today. Dr. Saluti, thank you for joining us.
Thank you for having me.
So I wanted to get started with what made you, because you own your own practice, which is absolutely phenomenal, and what made you step out on your own? Where did that passion come from? And tell us a little bit about your practice, because I know it's pediatrics.
So I started out as a general pediatrician. I did a pediatric residency, and then I did a primary care sports medicine fellowship. And then I practiced general pediatrics and pediatric sports medicine for about 9 years. And then after having my fourth child, I decided I needed to take a step back. So I was home for a little bit, and then I started to start my own practice and really just wanted to focus on the sports medicine aspects and not the general pediatrics anymore. So then I started my own practice, and I just do pediatric sports medicine full time now.
And it's located in?
It's in Plymouth, Massachusetts. Yep. And I'm a solo provider, so it's just me in the office. I do it all, meaning I'm the one who answers the phones. I check you in.
She's cook and bottle washer.
Yes. And then I see you and I check you out. And I did that on purpose. I wanted to just start my own practice, so I took some online courses and learned how to run my own business and start my own practice. So I started fall 2021, so it's been about 4.5 years, and it's going really well.
That's awesome. Yeah. And I've personally used Dr. Saluti for my children as well. And it's true, she's the one that's answering the call. She's getting you in pretty much right away because you have the capability to do that. She's ordering x-rays, she's ordering MRIs, whatever needs to happen. And she's reading and assessing them. And we've talked before about this, but the importance of, if you have a child, having a pediatric orthopedic reading these x-rays or reading these MRIs, the difference between a generalist and someone who is specialized in pediatrics reading them, and the importance of that. So seeking out, if your child, you see up to mid-20s, right?
Yeah, basically through college, I would see. I could see up till 25 or so.
Yeah. But if your child requires an MRI or an x-ray and you're going to a general orthopedic, that's fantastic and fine. But a second opinion by a pediatric specialist, I cannot recommend that enough, because they're seeing things very differently than a generalist would see it. Particularly, I'll stay on this soapbox for 1 second. If you're going to an urgent care and you're getting an x-ray at an urgent care, it's fine that they read it, that's great, that's helpful, but then have it assessed by a pediatric, because I'm sure you can give us plenty of examples where things were missed or misread.
Yes, yep, yeah, basically because kids have open growth plates, so that can be tricky to read on an x-ray. So sometimes the radiologist will read something as a fracture, but it's not a fracture, it's just their open growth plate. So then that's a big relief to the parents, or vice versa. Sometimes the radiologist might miss something, but I look at all my own x-rays, so I may see something that they don't, or they're read as normal, but then I see, oh, this kid does have open growth plates. So even though their x-ray is normal, it's probably irritation at that growth plate that the radiologist didn't mention. So yeah, it's different.
It's great, and I love that people are using urgent cares, because you're getting in a lot faster, but just ensuring that, particularly as a youth, if they're an active youth, doesn't have to be an athlete, but an active youth, making sure that a professional that specializes in pediatrics is looking at the screening, I think really important.
Yes,
all right,
I agree.
So we'll get into a little bit more of the questions. So given that you work specifically with youth, what injuries or overuse injuries are you seeing more frequently? Because that's really what we want to talk about today, overuse injuries. So what are you seeing most frequently in this overuse injuries category?
So I'm seeing a lot of heel pain, knee pain, and then some like shoulder and elbow pain. Those are my probably most common overuse type injuries because of open growth plates in those areas. So like a soccer player with heel pain, an adult orthopedic may diagnose them with Achilles tendonitis, and then I see them and I said, no, kids don't get Achilles tendonitis. This has to do with open growth plate in the heel. The Achilles tendon comes down, attaches on that growth plate, and can cause pain and irritation. So I'm seeing a lot of that. And then in the knee, there's something called Osgood Schlatter. Once again, open growth plate, usually from too much running. So kids can get some irritation in that area. And then, like I said, shoulders and elbows, more so in the throwing athletes that I'm seeing. Same kind of thing. Sometimes it's kind of an open growth plate. Sometimes it's just, it could be a sprain, tendon injury, or also stress fractures from overuse.
And when is the patient themselves or the parent, when should they get concerned? Because I know growing up a long time ago, it's growing pains. You're fine. Put a little ice on it. It's growing, and I'd be crawling up the stairs like my knees hurt so bad. Like, it's growing pains. At what point do you stop kind of saying that to your kid? Because it's not growing pains, right? This is an overuse issue. There's a repetitive issue happening. At what point should someone be seen? And at what point is it a little bit of a red flag for you to like, ooh, you actually need some time off?
Right, so that's a good question. Right, we don't want kids to play through pain. A little bit of pain is probably okay, but if obviously if they're limping, you shouldn't let them keep playing. So limping, I would be concerned about. Any pain at rest. If they're coming home from practice and they're having a little bit of pain right after, that might be okay. But if they're having pain like that night, the next day, in whatever joint that they have their pain, pain at rest, we don't like that either. Any pain waking them up at night from a sound sleep, we want to see them for that. Right, so we don't want to push through pain, because then that's what can cause serious injuries.
And what's the risk? What's the risk if they're playing through that pain, whether they're a pitcher or a runner? They've got this consistent knee pain. Maybe it's Gauss-Schlatters. What's the risk of just getting out there and playing with that?
Right. So different risks depending on what the injury is. But if it is irritation to a growth plate, there is a risk of doing permanent damage to that growth plate. Sometimes you can get cystic changes in that growth plate, which I've been seeing recently.
What does that mean?
So it's just it changed the bone. So the bone never even fused correctly, and now there's kind of like pockets where that bone didn't calcify. That's where those cysts in the bone.
It's not as strong.
And then, yes, and then that can cause this chronic pain. And then also, gymnasts, too much pressure on their wrist. They can get wrist issues of the growth plate, and then that growth plate can fuse too soon, and then your arm isn't going to grow as long as it should. That might be an extreme case, but that's the thing. If you're injuring a growth plate, sometimes you may do damage to it, and then it fuses too soon, and it doesn't grow the same as the other side, and can cause chronic pain. And then otherwise, if you keep playing on something like a ligament, like a sprained ankle, or a shoulder ligament issues, and you keep playing on it, then you could do some permanent damage to those ligaments, and then now you have an unstable joint that could cause long-term pain and instability in an athlete. Yeah.
And I think it's beneficial depending who's listening. If we got therapists listening, they're like, yeah, I already knew that. But if we have some parents listening, those growth plates, they're open because the bone's still growing. Your child's getting bigger, maybe they're going to get taller, they're going to grow into their body. If you're injuring that growth plate, the growth potential is limited, right?
Yes. Yep, exactly.
So you could see changes, you could see asymmetrical changes. You've got one leg, we've got all these adults that are like, oh, my leg's 2 inches shorter than my other one. Well, maybe there was an injury a long time ago.
Right, you injured that growth plate.
That caused something like this. So,
yes.
Are there any particular sports that if we've got someone listening and their child plays these sports, they really should be paying attention to it? I think we all know about baseball. I'm going to ask you a question about that after, but what other sports are a little bit yellow flag-ish for you?
Yeah, so sports that do a lot of repetitive motion, or that you have to specialize at a younger age. So like gymnasts, cheerleaders, and then swimmers, because a lot of them will specialize at a younger age, and that becomes their only sport. So in gymnastics, cheerleaders, sometimes you can get like stress fractures or those overuse injuries to the growth plates, because it's not just repetitive and impact motion. Where swimmers, they can end up with shoulder and sometimes neck problems from that repetitive overuse type motion. So those sports that you have to specialize at a young age, more likely you may end up with some overuse type injuries. And then I kind of already touched upon the throwing athletes. so baseball pitchers, softball pitchers, well, I would say less softball pitchers than baseball pitchers end up with, shoulder or elbow issues. Yeah.
Yeah, okay.
Yeah.
That's helpful. The swimming one is not one that I often think of, but yeah, that's very
true. Swimmers have to
true.
specialize at a young age usually.
Yeah.
Yep.
So I wanted to ask you a little bit about elbows and Tommy John surgery, because some of the things that we hear little whispers of in the clinics sometimes from parents or players themselves is, I'm gonna need that surgery at some point. Why do I care if it tears now and I get the surgery now? Let me get it over with. Let me get my Tommy John over with. I want to have the surgery, right? Because people think you're going to be 100%, right?
Yeah.
But the short of the long is, not everybody comes out of those surgeries 100%. Right. There is a big risk with them. So if you don't have to push yourself into that. But do you see that happening a little bit on your end as well, where people are kind of like, let's keep pushing through?
Yeah, no, I haven't heard that they say, let's just get a Tommy John surgery over sooner than later.
Get it done now, yeah.
No,
Wild.
but right, we are seeing Tommy John surgery, which is when they tear a ligament in their elbow, and they need that repaired. So we are seeing that younger kids, like middle school age, who are tearing that ligament, needing surgery. So that is really young. And and people may think, okay, right, just get the surgery and then I'm good to go. But no, right, like you said, some people don't recover like they should. They end up, even though that ligament is repaired, they can end up with long-term damage. Once you have surgery, not every joint, but some joints, you are more likely to get arthritis because you've had, there's been equipment in there moving things around, so you are more likely to get arthritis down the road. And then, like in a pitcher, you may never get back to your full speed pitch after doing Tommy John. Like, yes, hopefully you can, but it doesn't help for it's not for everyone.
Yeah, absolutely.
Yeah.
Okay. So you talk a little bit about the growth plates and maybe some joint abnormalities, cystic changes that you might see. Do you think, and this is one of the conversations we've had in the clinic, do you think that 20, 30, 40 years from now, when those athletes, those youth athletes are now adults and they're coming up more on that, the arthritic changes that they're dealing with now, and they need a joint replacement, a hip, a knee, something like that, do you think there's potentially implications from the overuse injuries maybe causing additional bony abnormalities that we haven't seen before that could affect them 20, 30, 40 years down the line?
Yeah, it definitely could, because kids are so active these days. They're always, they're trying to get ahead, become better athletes, so they are playing a lot more than we used to. So yes, they could have some long-term issues, like we said, kind of arthritis, joint instability. So yes, if you're not taking care of your body now, it could definitely have long-term issues. And so I only do pediatric medicine, I don't do the adult side. I would say that people are needing more knee replacements or partial knee replacement at younger ages because of what they did. They did too much when they were younger. And and that these kids these days are so active that yes, we probably are going to see that down the road. But hopefully, with everyone getting the word out that doing too much sports specialization, that we start to see an improvement and kids are not overdoing it. And so 20 years from now, they are not in as much pain and we're not seeing as many knee replacements, partial knee replacements.
Yeah, I think the key is it's a difficult conversation. We don't want to scare anyone away from playing sports. It's so important to keep you healthy and to keep you strong. I think where we get a little weary is that sports specialization and that overuse injury. Playing through an overuse injury really is where the murky waters are of like, you really got to stay out of that. But if we quickly, we had a conversation earlier where we had our mom hats on because we're both moms. It's hard to not do sports specialization because when the kids are young, that's just, if they don't do that sports specialization, sometimes they fall behind their classmates and they're like, oh, but Johnny or whoever is playing for this other team, and if I don't do that, I'm not going to be as good as him when I come back in the summer for XYZ. That can happen, and that is something that the kids themselves are seeing. But for whole body health and whole sort of that life cycle health as an aging adult, splitting your sports and choosing different activities like Tom Brady, we'll throw the name out there.
I was just going to bring up Tom Brady.
Yes, okay.
How he played different sports.
He played different sports. He promotes that as well. The science backs it up. And hopefully what we're seeing is less people choosing that year-round sport and taking a little break and mixing up swimming with karate or whatever it may be, so that it's just not that one sport all year round with the overuse happening at one particular joint.
Right.
Yeah, so we just want to bring that up too. It is important to stay fit and to stay healthy and to stay active. I think what we get a little concerned with is that early sport specialization, year-round play without taking sufficient time off.
Right.
Just find another activity, hopefully, you know, or take some time off.
Right. So as far as so resting your body, taking time off. Right. We recommend don't specialize in one sport probably till about 15 or so. And then if you are playing one sport all year round, you should really take 1 to 2 months off of that sport per year. It could be, you know, it doesn't have to be consecutive, but you should try to take 1 month off at one point, 1 month off at another time. And I know in some sports that's really hard to do, but you should try. And then you should always have a day of rest during your week. Like you should not be doing a sport every single day. I will say that 1 to 2 months off of rest a year from a certain sport, you can play another sport in that time. It doesn't mean you're off from sports altogether. You can just from that, your sport, you should always take 1 to 2 months off. And then same thing, you shouldn't play one sport, 7 days a week. You should take 1 to 2 days off of that sport per week. If you're playing a different sport, that most likely is okay. And then age-wise, so if you are 13, you should not be doing more than 13 hours of one sport a week. It's okay if you kind of mix in other sports, but you don't think of your age. Or if you're an 8-year-old, you don't want them doing more than 8 hours of one sport a week. So kind of keep that in mind.
That's a great tip.
Yes, yep. And then, just doing multiple sports is good to build different muscles, or give one joint a break while you're doing another sport. So that's where doing multiple sports instead of just one can be really helpful on your body, but also helps with burnout. There's a lot of kids who get to, I've seen it.
High school, they're done.
Yes, they get to, they've played sports their whole life, and then they get to high school and they're like, I don't feel like playing. And it was their favorite sport.
It can be so competitive too.
Yeah.
Yeah. That they're just like, I'm done.
Exactly.
Yeah.
So
we see that a lot as well. It's very true.
Yep.
So be careful of that burnout. The children experience it too.
Yeah.
It's not just us ladies in our 40s.
Right.
But I wanted to, this is not our area of expertise, but it warrants mentioning as we talk about these injuries and playtime and all of that stuff as well, is the critical importance of, particularly for our younger boys who are a little ADHD, gotta go, and a lot of our women that are youth athletes, the nutrition piece, and ensuring that you are taking in more calories than you're burning, to help, again, protect the bones, protect the joints. If you're not getting that appropriate level of nutrition and caloric intake, that's a huge detriment to the body as well, and can be very concerning.
Yep. And
can result in injuries as well, correct?
Yes, exactly. Yeah. We could do a whole nother episode on nutrition. But growing bodies, they're going to need a variety of food. So make sure they are eating their 3 meals a day, a couple snacks in there. Busy kids who are go and go right from school to their practice, make sure that they are packing a snack that they can have in between school and their practice. You want to make sure they're getting the fruits and vegetables. Kids need their carbs, they need their protein, and they need their fat, because your body could have all this stuff in it, but if you don't have the fat to help process and digest, then none of that will matter. So
a couple donuts here and there.
A couple.
As a mom that stopped at Dunkin' this morning and gave her kid 2 donuts for breakfast, that's okay every now and then, right?
Yes.
Yep. Okay, that's good news.
It's okay.
Running late.
Yep.
Yeah.
And drinking enough water is so important.
Yeah.
And then getting your calcium in, and getting enough sleep at night. So another thing, there's studies that show athletes who don't get enough sleep do not perform as well. So always making sure, different amount of hours for different ages, but high school kids, 8 to 9 hours at night at least.
Yeah. The risk is not just being skinny and out of shape. The risk is, actual bone injuries, because it's just not as sturdy as someone who's eating appropriately.
Yes. Yeah. So right, if you aren't putting enough energy in your body for the energy you put out, then your body starts to shut down things it doesn't think is as important. So it can stop putting calcium in your bones because it thinks your bones aren't important as like your brain, your heart, all your other organ systems. So it starts shutting down systems it doesn't think is important, and then you can get weaker bones and cause stress fractures. So nutrition is so important.
Yeah, thank you.
Yep.
We talked a little bit about the injuries, nutrition, some red flags, some yellow flags. Where do you see advancements in orthopedics going that maybe can support some of these things that we're seeing? Or are there changes happening in orthopedics on the youth side of things?
So I think just more injury prevention programs can be helpful. So that's where just people being more.
I love to hear that.
People being more aware of when they're in pain, to not play through the pain, and then if they realize they do have an injury, then they should be starting some sort of injury prevention program, whether that's meeting with a physical therapist and helping diagnose what the problem is and then figure out their deficits. Like I always say, I don't like to use the word, oh, you have a weakness in one of your muscles. It's just it's an imbalance of the muscles, because no one wants to hear they have a weakness. So it's an imbalance, and probably is like one muscle is just a little stronger than the other. So working with a physical therapist or athletic trainer to help with that. But in general, even if you don't have an injury, some sort of injury prevention program that, coaches who are doing like club sports, they should be doing like some strength and conditioning built into their practices. And then the strength training can be really good. So that's lifting weights. So that can be really helpful for injury prevention.
With someone who's trained.
Right, with someone who is trained, yes, as long as they know what they're doing can help them. Yes, yep. And then other things like, there's like specialized like running evaluations you can do. There's programs you can go to where they put all these electrodes on you and figure out like biomechanical issues. So there's advances like that. Even like smartwatches can test these different things that we couldn't do years ago. So these are kind of all things that hopefully can help prevent injuries.
I think it's great. I think a lot of us that grew up in the 90s with the coaches, I won't just say parents, my parents were great about things, but coaches that were like, play through the pain, or, of course it's gonna hurt, and we just did it, and then we got hurt. And we're still hurt, emotionally and physically, but now we're the parents, and so we're like, oh, wait a minute, this could really be detrimental, and the research now shows how important these strength prevention programs are. If you play soccer, there's different strength and conditioning programs that are researched back. That's like, if you do this, you're 60% or whatever it is less likely to get injured. It's like, of course. So coaches are doing it. So the education piece and the acknowledgement of if this, then that is huge right now. So conversations like this, where we're talking about it openly, there's no shame in it. We've all done it. We've all, pushed our kids maybe further than we should have. We talked about that earlier off camera as well. There's things that you do and there's things that you know about, and just trying to ensure we're not forcing anyone and creating injuries that didn't need to happen. A lot of these overuse injuries are unfortunately injuries that didn't need to happen if at some point someone said, hold on. So just getting this information out there to parents, coaches, the athletes themselves, so important. So I want to thank you so much for your time today. I appreciate you coming down here. We're in Buzzards Bay. Dr. Saluti's practice is not far from here, right in Plymouth, Massachusetts. Again, she's seeing pediatrics. So little children, what age are you kind of starting?
I'll see 1 2-year-olds. I'll see.
Good.
And all the way up, like I said, through college. I'm mostly seeing middle school, high school athletes. That's primarily what I end up seeing. And it doesn't have to be an athlete either. You could have an injury. You don't have to be an athlete. Even though we call it sports medicine, I would see anyone. And it could be an acute injury, overuse type injury.
Great. Well, thank you, and thank you for your time. And I will kind of post under there, wherever I put this. I'll have my website, I'll have our website, and I hope this was helpful. And if it was helpful, please share this with people. We appreciate that.